Kidney disease, a topic not many people know or want to talk about. But with the rise of chronic kidney disease, or CKD, donors are needed more than ever. As many as 9 in 10 adults with CKD do not know they have it, and about a third of adults with severe CKD do not know they have CKD. A nurse at St. Anthony's Hospital in OKC was one who found out she had it asymptomatically.
My mother is a transplant recipient because of kidney disease, and I ended up going to be tested myself to try to give her my kidney, and that's how we found out that not only does my mother have it, I have it.
According to a study published by Scientific Reports, the risk of developing CKD is significantly higher among individuals with family members affected by CKD.
Has personally affected a large majority of my family, and I've had several family members unknowingly die from kidney disease.
The past decade has been a significant increase in CKD patients, but the number of donors has remained at a constant.
When I first started in Norman, the average wait time, this was 2006, the average wait time was about 2.5 hours for a cadaveric kidney. So it's a deceased donor's kidney. So someone would be on the wait list for a little over 30 months, somewhere there, average time span. I've been in Norman since '06, so today the average wait time is about 4.5 to 5 years.
There is a lot of distrust when it comes to organ donation, but donating has little to no impact to living a long-filled life.
I think one of the main things that the public should know is that donating an organ does not lessen your chance of living a long, fruitful life.
Katie Hollum, a local student at Gaylord College, found out she had kidney disease at only 18 years old.
So when I was 18, I got the stomach virus after watching a movie with some of my friends, and I noticed that my ankles were swelling and my urine turned red pretty shortly after that. And so I went to the emergency room, and they told me that they thought I had urinary tract infection, but I wasn't posing any other symptoms of a urinary tract infection. So I was tested again, and they sent my test results to my doctor, who called me the next day and told me that I needed to see a nephrologist, stat. So I was sent to a nephrologist the next day, and he ordered some blood work, and then he ordered a kidney biopsy, told me I could have lupus or a disease called IgA nephropathy. And the next day I found out I had IgA nephropathy.
With the average wait of 4.5 to 5 years, some people with later stages of CKD might require more immediate transplantation. To speed up the process, Halem decided to take things into her own hands.
So I made a TikTok, I think last July, August maybe. It was a complete joke because I've never felt comfortable asking people to donate their kidney to me because I'm otherwise very healthy. So this TikTok that I made was a complete joke, and it was to the audio of "You have something I want." And I had just gotten off work, and I had been thinking of the audio because it was trending at the time. And so I made this video of me like coming out of like this door, and it says, "You have something I want." And it says, "When I overhear you talking about your healthy kidneys and oh blood."
You have something I want.
And it blew up. People, it went viral. I think it had a couple 100,000 likes. People loved it. And people were commenting on it, and they were saying, "I want to donate to you." And I remember thinking, you are complete strangers. You do not know me. But this one girl was so adamant, and I ignored her for the most part, but then she started messaging me on my other videos and started messaging me through my other social media saying, "I'm your age, I'm studying to become a nurse, I know what it's like to be on dialysis, because I've seen some of my patients being on dialysis, and so I really want to donate to you if you'll allow me to get tested." And so I tried to discourage her as much as I could, but she was pretty adamant on doing it. And then I found out in April she was my perfect match, my perfect cross match, which is very rare. I think it's a 1 in 20,000 chance that she'd even match with me. So very, very intense. And we're waiting this week or next week for a final yes or no for the transplant center.
Social media can be a powerful tool to spread awareness and to ask for help. If you would like more information about CKD or the process to donate, go to kidney.org. I'm Lucas Mann, Gaylord OIDJ.